I'm Lauren with FindMyDentist.com, and today I'm going to be talking to you a little bit about the importance of oral cancer screenings during your regular dental checkup. Dental professionals are the number one most responsible in healthcare for detecting many types of oral cancer that can occur in the mouth. When you go to the dentist or when you see your dental hygienist, you should expect to have an oral cancer screening because they can literally save lives. The majority of oral cancer occurs on the posterior or back portion of the tongue, which a lot of times you cannot detect on your own. So it's important to see an oral health professional who can retract the tongue, who can use adequate vision and adequate light to see if there are any cancerous lesions in the back of the mouth. In addition to cancer of the tongue, which occurs, as I said, in the back of the tongue and also on the sides of the tongue, there can be bone cancers called odontomas on the floor of the mouth and the roof of the mouth, as well as cancer anywhere else, in the cheeks, on the lips, and a lot of times dental health professionals will look on the face, inspect the symmetry of the face, and see if there are any lesions that seem amorphous or discolored, and they would then refer you to a physician to have that checked out just to be on the safe side. There's a couple different types of cancers that we deal with in dentistry. One is basal cell carcinoma, which usually occurs on the middle third of the face where you've been exposed to a lot of sunlight. Basal cell carcinoma has a fairly good prognosis when it's detected early, which is why you want to be sure that when you do go to the dentist, you have them look at your face, and if you have any lesions, kind of see if they think that you should get a closer look at them and have them biopsied. If it's detected early, basal cell carcinoma, it usually doesn't spread, and it can be removed either cryogenically, which means that it's frozen off. It can be surgically excised, or a lot of times if the lesion is small, it will heal if you just put a topical cream on it that can be prescribed by a dermatologist. Another type of cancer that we look for in dentistry is squamous cell carcinoma. This type of cancer is a little more serious than basal cell, but again, if it's caught early, it does have a good prognosis. It's usually surgically excised because it can spread, and we look for that as well in dentistry on the surfaces of the skin and on the inside of the mouth. The last type of cancer that we can detect clinically as oral health professionals is malignant melanoma. This is a very serious type of cancer, which is why we want to detect that early. And every time you go to the dentist, which should be on average about every 6 months, you want them to take a good look and make sure that you don't have any of these lesions, just to be safe. Malignant melanoma on the inside of the mouth often looks blue or a dark red. It can bleed, and it's usually a raised lesion. The reason that malignant melanoma is so dangerous is because it spreads, instead of spreading deeper into the skin, it also spreads laterally, so the area that metastasizes becomes longer with the passing of time. Malignant melanoma usually has to be treated with radiation therapy, chemotherapy, and it has a good prognosis if it's caught early. The longer that it is allowed to metastasize, the more dangerous that it is. And when you go to the dentist and they inspect you for any type of cancer, any abnormality, you should expect them to palpate some of the lymph nodes on your head and neck. They should take a closer look inside of your mouth, lift the tongue, make sure that there are no lesions on the lateral borders or the back of the tongue. Look at the floor of the mouth, and also feel around what we call the alveolar ridges, which is the bone that encapsulates the teeth, and make sure that none of the bone is abnormal. There are no suspicious lesions around those areas. I'm Lauren with FindMyDentist.com, and this has been checking for oral cancer and cancer of the head and neck in dentistry and the role that we play as health professionals. Thank you.